What's up? It's Dr. Torrance. I am here at the Sarasota office of our Regenix at Regenerative Orthopedics of Florida, and I am waiting for my esteemed colleague, Dr. Pappas, to get on. We are going to take some questions here on our lunch break and dive in. Add to stage. Here he is. Dr. Pappas, we are live. We are streaming. Figured I'd get started. You have a little technical difficulties. I was too. So Dr. Pappas here with us at our Tampa office. I'm in Sarasota. We serve Tampa, Sarasota, St. Pete, and Orlando. And we're super grateful to field some questions here at our lunch hour. One of the biggest questions I get, Dr. Pappas, is what is PRP and what is high concentration PRP and what's the biggest difference there?
Yeah, I actually got this question from a patient this morning.
Mm-hmm.
So this patient had PRP injected at a chiropractor office in his back.
Mm-hmm.
And he had that exact same question. I asked him, how many tubes of blood did they draw? And his answer was 1 or 2. And so this is important because the amount of blood that you need in order to make high concentrate PRP is quite a bit more. You know, often for a comprehensive back procedure, you might draw 25 to 30 tubes of blood. For context, about 54 tubes or so is a pint of blood. That's what you would donate. So a little more than half of that is what we would use typically. But PRP, the thing with it is that the dose matters. And so like any medication, you got to get the right dose. And what the studies have shown over the last few years is that generally the more platelets you have, the better the outcomes. And so you need to get a certain amount of platelets in order for something to be effective when you're treating either joints, tendons, ligaments, or what have you. So for a lot of providers out there providing PRP, most of the time their quote PRP kits are concentrating their platelets to between 1 and 3 times the level of the platelets that are in blood. This is important because the literature definition of PRP is 5 to 7 times the concentration that's normally present in your blood. And so a lot of these kits out there aren't even real PRP, or they wouldn't meet that literature definition of it. So typically when I'm injecting a back, oftentimes I'm using either 10 times the concentration or 14 times concentration when we're injecting the joints of the back. When we're injecting discs of the back, it's very important to have 20 times concentration of that platelets. It's also important for it to be leukocyte rich as well. And so there's a lot of different technical parameters that a lot of people in this space aren't just really following. You know, a lot of people dabble, you know, they do PRP or something like that 5% of the time with their patients. And so when that happens, a lot of times they don't know this. They get the cheapest kits available. They don't concentrate the PRP very high. And in this particular patient's case, he was at a chiropractic clinic and they were just doing blind injections, you know, in a haphazard way into his back without any image guidance or thought, you know, on what structures we should actually be injecting.
Very nice. Great description. I wrote something up on the board here just so we could kind of look at the perspective here. An absolute platelet count is something that we're really, really dialing in and kind of leaning more towards in this space. And so when he's saying 14 times concentration, that's about 3.25 billion platelets on a standard person, somebody with about 250,000 units per deciliter. So 3.25 billion. Okay. And so we're trying to get into a knee for knee arthritis. If somebody has knee arthritis, we want to get above roughly 10 billion to get a functional outcome. So you need about 3 cc's of that number. Now, what most kits are returning when you look at these kits that most of these offices are using, they're getting about this 5x concentration, if that, right?
Or less, yeah.
More or less. So that's about 1.25 billion. So you need to put in about 8 cc's, give or take, 7 to 8 cc's to get a functional, a good dose and a good outcome. So these are just kind of some good numbers. I have them on my dash, my whiteboard in St. Pete, but I think these are really good things to kind of drive home for the patient who's looking for a quality, high concentration PRP procedure. And I saw our esteemed colleague, Regen Cell Doc, the knee arthritis specialist, jumped onto our feed. drop us a question, brother. Why don't you tickle us here? Anyways, so that's good. That's good. I think this is a great topic that I think too many people don't know enough about. Now, you touched on image guidance, Dr. Pappas. What can you tell us about image guidance and how accurate things are when they aren't?
Yeah. So, having used, X-ray guidance and ultrasound guidance for all of these procedures, it really gives you a sense of how precise you need to be in order to really get the PRP or whatever substance you're injecting to the right spot. And so you just realize that a lot of people who do, the palpation guidance, or we call blind guidance, there's just very little chance that they actually are where they think they are. Even in studies where they looked at knee joint injections, which is a relatively easy joint to get into, and the studies that have looked at that with providers that have done knee injections for decades found that actually even providers that have done knee injections for decades are only getting into the joint maybe 2/3 of the time. And so a third of all their injections are actually missing the target. Usually they end up in the fat pad, which is actually quite painful for patients, especially if you're injecting something like hyaluronic acid. So some patients will come to me and they say, "Oh, I had those gel injections. That was the most painful thing in my life." It's like, okay, well, they're actually not painful when you inject them if you inject them into the knee joint. They're painful when you inject them into the fat pad, typically. That'll really hurt.
Absolutely. Image guidance is vital and a must. And we think it's below standard of care for patients to be injected without ultrasound at this point. I think that anybody who's doing those injections should refer to one of us to make sure that we do these injections the right way for their patient, because it's doing a disservice. And then one of the things that people like to inject the most is corticosteroids. And Dr. Pappas, I know you have a good take on what corticosteroids can do to joints and tendons. And why don't you touch on that real quick?
Yeah, so steroid injections, 99.9 probably percent of all the injections in this country are done with steroid injections, and they are okay at treating pain in the short term, but bad in the long term. And that's because the steroids are toxic to cartilage, they're toxic to tendons. And so the more steroids that we put in the knee, the faster that knee results in a knee replacement. And multiple studies have shown that. So, if you have 6 weeks to live, steroid injection is probably the best option. But if you're looking for long-term relief and solution, I would highly recommend against it.
Yeah, awesome point there. And then one of the things I like to touch on too, especially with you, is like the Tampa area. We have a lot of patients who are part of our corporate program. And one of the things I talk to patients a lot about is that we've tracked our outcomes for a long period of time, and we have benefits companies that cover our procedures. Pasco County is one of the people that cover you in that area. Crown Automotive, Morgan Auto, they all cover our procedures. And what does it mean to you to be able to give this to patients who might not be able to afford it otherwise?
Yeah, it's great. So about 25 to 30% of my patients have corporate benefits, meaning that their insurance will cover procedures like this because their companies have contracts with Regenix based on the fact that the companies can actually save money by having things like our procedures compared to a knee replacement. And when they track the outcomes and they track the complication rates and all of the things that go into that, they find that the better option oftentimes is to try a procedure with bone marrow stem cells, like an intraosseous injection, in order to help people avoid those kind of major surgical operations. And so being able to offer that to patients and being part of the only network that does offer that to patients is pretty special.
100%. One of my favorite patients is she had some bad, it was knee arthritis. Wasn't super bad, like maybe mild to moderate. We did some PRP, and she's loved me for ever since. She's one of the special needs bus attendants, and she's with Manatee County Schools. So somebody I really truly think that they're able to get the benefit out of what they're getting from their benefits package. So that's fantastic. Anything else, Dr. Pop, is top of mind for you? What was your case of the week that you feel like is one of our favorite cases?
Case of the week, one of the favorite cases. I had a lot of spines this week, so a lot of low back pain, doing comprehensive, procedures, injecting around discs, around nerves, into joints. And so these procedures, often will take about 45 minutes or so to inject all of these different structures. Oftentimes we're targeting 10 to 12, sometimes more structures in the low back, depending on the patient's back, because you want to hit structures that not only are in pain, but also the structures that support those painful structures as well. So a lot of low backs this week, all went very well. One of the things that we treat the most of is low back pain.
Yeah, and he's talking about image-guided, fluoroscopic guided injections. That's something that your chiropractor down the street and some of the other people who are in this space usually don't have access to. And they are fantastic injection when they're done right. Platelet-rich plasma into the facet joints, platelet-rich plasma into your interspinous ligaments to help stabilize the spine, and then transforaminal injections around the disc and things can help immensely. So absolutely something that we can do, and something that we see every day, like you said. So all right, well, listen, we wanted to touch base here on lunchtime, again, serving Sarasota, Tampa, St. Pete, and Orlando. Let us know. Go see Dr. Pappas for a consult. Go see myself for a consult in the Sarasota or St. Pete office. Dr. Pappas is out of our Tampa office only, or see one of our other clinicians if you're closer to our Orlando office. So if you have any other questions, please feel free to reach out. Have a wonderful day.